process mining has tremendous potential when applied to healthcare claims data. First of all, it compensates for the lack of domain knowledge on the part of the analyst. This lack of domain knowledge on medical codes, drugs, and procedures is nothing to be ashamed about. No single individual will ever be able to have domain knowledge on all the possible medical codes, drugs, and procedures. There are simply too many. That's why there are so many different specialties in the medical field, such as general practitioners, nutritionists, cardiologists, pharmacists, physical therapists, and many more. In our simple example of a knee replacement surgery, we can already suspect that an X-ray for a knee is a predictive factor for getting a knee surgery. Using this knowledge that we have derived through process mining, we can now create statistical machine learning models to predict knee surgery, using X-ray as our predictive variable. You may say, well, that's common sense. But mind you, in reality, we are working with thousands of different procedures and drugs, many of which have complicated scientific names derived from Latin or Greek. So we need all the help we can get to understand and visualize the relationships between these events. Process mining not only helps us with understanding the relationships between events, it also provides us with information about the sequence of events. Once we understand the sequence of events, we can construct predictive models using statistical tools. In addition to this, we can use process mining to map out all kinds of billing and administrative processes in healthcare. We can use this to detect irregularities, measure waiting times, or check if patients and providers are adhering to therapy protocols. Quite often, quality improvement projects in healthcare are centered around episodes of care and improving patient logistics. Process mining will also help us analyze and monitor these patient pathways. In certain systems, providers are reimbursed per episode of care in so-called bundled payments. Thus, process mining may also be useful to provide factual input when developing bundled payment systems. Now that we have an idea of the potential of process mining with healthcare claims data, we can move on to the practical application of process mining. See you in the next lecture.
If you're interested in learning more in-depth information about healthcare claims data, then you should definitely check out my online course about data science for healthcare claims data. This course contains hours of lectures covering both theoretical knowledge as well as hands-on practical activities. Click on the link in the description of this video to access this course.